Good evening and welcome to the COVID-19 update on Channels Television. I am Kayode Kikyolu. Here are some of the highlights. 30 days to the first major election in the COVID-19 era, and INEC calls for strict compliance to safety protocols during the forthcoming Edo and Ondo governorship elections. Persons living with disabilities in Niger State ask the state government to carry them along in the fight against COVID-19 as they face economic difficulties. And a cluster of over 30 COVID-19 cases discovered in a Scottish company, prompting its closure and possible restrictions from the government. Well, thank you for joining us on the program. Nigeria's daily COVID-19 cases have spiked to 593, the highest in almost a month. The last time Nigeria recorded over 500 cases was on July the 28th with 624 cases. And ever since then, we've averaged less than 400 daily cases. Well, it is not clear what caused this spike as Nigeria gradually reopens economic, religious and social activities with worship centers, schools and other public places coming back to life. 50,488 cases of COVID-19 have been confirmed so far, with 37,304 discharged and 985 deaths. A breakdown of the latest figures as released by the Nigeria Center for Disease Control NCDC shows 15 states and the FCT account for the 593 cases, Plateau with 186, Lagos 172 cases, FCT with 62, Oyo 27, Delta 25, Rivers 20, Ondo 19, Edo 18, Kaduna 17, Enugu 12, Akwa Ibom 10, Ogun 7, Abia and Gombe 6 cases, Kano and Osun with 3 cases each. And moving on to other stories, conducting elections in the COVID-19 context has been on the front burner for the Independent National Electoral Commission, that's INEC, as we count down to the Edo governorship election on September the 19th. Saddled with the constitutional responsibility to conduct elections and the need to ensure that public health safety is not compromised, the Commission today acquainted journalists with the processes and procedures which it is adopting for the Edo 2020 governorship election in the face of the COVID-19 pandemic. At the briefing in Benin City, the Edo state capital, the Commission asked all stakeholders to conduct their activities in line with the guidelines.
The Commission is conducting the Edo and Ondo governorship elections and 15 outstanding by-elections within the context of COVID-19 pandemic that has substantially altered the previous ways of doing things. The Commission has also responded timely, creatively and innovatively to the pandemic by altering the modus operandi of conducting elections. Within this context, therefore, the Commission designed and released its policy of conducting elections within the context of COVID-19 pandemic. The Commission has also released the first supplementary to regulations and guidelines for the conduct of elections, as well as supplementary regulations and guidelines for the activities of political parties. Within this period also, the Commission amended and released the supplementary guidelines for election observation, voters' code of conduct for elections during the COVID-19 pandemic, as well as the code of conduct and rules of engagement for security personnel on election duty. The Commission will avail you with these documents to equip you with good understanding of the processes, procedures, and nuances of conducting elections under difficult circumstances.
Well, let's head over to Niger State, where persons living with disability are calling the attention of the state governments to their plight as they continue to battle the difficulties forced on them by the COVID-19 pandemic. The physically challenged persons who spoke their minds at a one-day sensitization and distribution of palliatives event organized in Minna by a non-governmental organization say they are not being carried along by the government in the fight against the pandemic. Our correspondent, Empress Simon, reports.
Every person with disability or child of someone with disability went away today with palliatives worth 25,000 naira. And we have prepared for 50 adolescents to have access to the palliatives that we are giving. They range from rice and palm oil to wash hand, liquid soap, bathing soap, toothbrush, sponge, to pants and sanitary towels and beverages. They also can drink hot chocolate with milk, Indomie and the rest, So we've decided to spoil them a little for this period.
Persons with disability have not been carried along in this COVID-19. If you ask me, both federal and state governments are not carrying persons with disability along, because the task force said we are not represented. So anything that is being done, we are not represented. And the way forward is for us to obey the protocols laid down by medical practitioners to protect ourselves. But as far as government is concerned, nothing to write home about. We are citizens of Nigeria, and both the president and the governor, we did exercise our franchise by voting then. I don't know why now that we have been neglected. So I feel very unhappy, to be honest.
From Niger State, we move to the temporary junction in Orka, a major motor park in Anambra State. And seeing that the times are different, the transport companies who don't wish to have their parks shut down have been sensitizing passengers on the need to stay safe. But some of the passengers say the strict compliance to the preventive protocols has increased transport fare. Meanwhile, the state has employed the services of several security agencies to ensure effective enforcement of some of the preventive protocols put in place for transporters.
And we believe, by sanitizing ourselves, taking the measure precautions, we believe we can be safe from COVID-19. Because when I was coming, they did exactly well. Two passengers per passenger seats, and in front, one passenger, directly keeping the rules and regulations. The transport fare is not becoming much, at the higher rate. But we believe, by God's grace, with time, the COVID-19 will just pass by and they'll go back to their usual, fare.
Well, let's head over to ABUJA, where ABUJA joins us this evening. He's a medical laboratory scientist. Well, good evening, and thank you for joining us on the program.
Good evening, Kayode.
Well, I'd like to begin with... well, good evening to you too. I'd like to begin with Nigeria's latest figures, really, because the Presidential Task Force began by paying tribute to those who have lost their lives. And you see that we've seen a spike in Nigeria's COVID-19 cases, 593, and that's the highest we've had in over 3 weeks, and 4 deaths, well, over 200 discharges. But when you look at those figures, really, what comes to you?
Well, it's not surprising. Why? Because till this evening, we are not testing enough. I also want to believe that the more we test, the more revealing the number of COVID-19 we see in the country. So the 500 and over 500 that we have seen as of today is not surprising. I want to encourage that we should test more. We have the capacity, we have the facility, we have all that it takes to test. The gap is in sampling. People should be recruited, maybe volunteer medical corps should be recruited and sent to the field and sample enough citizens. For instance, now that the exiting classes, they are going, they are writing the exams, why don't we deploy enough number of personnel to go and have a baseline testing? Again, I want to say that by the time that we have a very good rapid testing kit that will augment this and will help in testing more, we will see more, we will see wonder. We have so much active cases that are yet to be detected. We have so much active cases that are yet to be tested. So the more we test, the more revealing we will see.
You know, if there's any topic or issue that has remained elusive for me personally in this fight, it will be testing. So, for example, you as a medical laboratory scientist, you're asking us to test more. The NCDC is saying we should test more. The people are saying we should test more. And I'm thinking, wait a minute. So who can really make the decision to help us test more? So let me see if we can really solve that tonight. At whose table is that decision?
Thank you. So some time ago, thank you so much, guys. Some time ago, I provided a solution to this, and I want to reiterate that. Now, one, people are afraid to be tested, probably because they felt when they test positive, death sentence is pronounced on them. I think the National Orientation Agency need to do more by telling people that when you test, you save the nation. When you are when you subject yourself for testing, you help a generation. So that reorientation need to be brought to bear. Number two, we need to engage stakeholders in the community. We need to engage traditional rulers, engage celebrity, engage all manner of influential people in the society. Engage them, let them drive this process. Let people come out to be tested. That there is advantage in testing than abstaining. So the problem is in availability of people for testing and then availability of manpower for such routine work.
You know, a lot of issues come to mind, especially because we're also moving towards elections in the coming month. That's in Edo State and afterwards Ondo State. You wonder, with the pictures we have seen from the campaigns, and of course INEC is speaking about the elections, you wonder what might happen in the coming days. But these are some of the issues that I'll take you up on when we return from this break, especially also because you mentioned rapid test kits, and that has been quite controversial. But we need to go on this break, Mr. Ovie. And when we return, aside these issues, we'll bring you news from Scotland. There's a lesson to learn from there, as over 30 workers in a particular company have tested positive for COVID-19. Please stay with us. You're welcome back. Well, let's rejoin Mr. Ovie, who joins us from our ABUJA studio this evening. He's a medical laboratory scientist, and we'll be discussing Nigeria's response, the trends, and maybe what to expect in the coming days. Well, thank you for staying with us. I was talking about, the major events we have in the coming months. We have elections, schools have since reopened, and, it's been some eventful journey for Nigeria. So if you can help us, briefly to know where we are right now in this journey. Are we at that point where there's a calm before a storm? Because, it seems our cases are declining, or really, where are we in this journey?
Yes, we are in a critical point in our journey as a nation. It's a choice between going forward, daring the challenge, or staying back home and allowing our economy to crumble, allowing the health of people to suffer. Because even the lockdown itself affects health negatively. Because where there is inactivity, health of several persons will be compromised. Therefore, it's a choice between liberating people and confronting the big devil ahead of us. So we are in a critical phase. Going forward, on the issue of election, there is challenge ahead. I so much believe that there is going to be a hike in the number of positive cases. As schools are resuming, we are going to have that. We might finally pick it up. It might get to the peak in no distant time. But in midst of all of these things, I want to just encourage government to make things much more comfortable for our citizens, so that by the time that people eat well, people have very good immune system. Some of these challenges will be the impact will be minimal. Now, currently, I want to raise something very fundamental. There is a component of this fight that is missing. In histopathology, for instance, there is a saying that the dead teach the living. Have we maximized information from those that died from COVID-19? The answer is no. There is need to have guidelines that we be engaged in autopsy, so that things like lungs, COVID lungs, should be harvested and keep in the museum for further study in the nearest future. In the next 5, 10, 20 years, we need information from this lung. It's going to tell us things that we don't know now. But can we dare harvesting COVID lungs now? Can we do some histopathological work on those cases now? The answer is no, because there are no guidelines. There are no guidelines. So to dare that is a society, it's an attempt on societal, it's a societal attempt. So, but by and large, I know economy is being opened gradually, and other sphere of life is resuming back to full life.
Right.
There is going to be spike, but overall, Nigeria will beat this. Will beat Lassa fever to some extent. We beat other serious viruses in the recent past. I know even this, we are going to beat it, but caution.
Right.
People that are going out now that things are being liberated, people should be cautious. By the time I prevent myself and my neighbor is not careful, it's a threat to me.
Right.
So, in as much as I wear my nose mask and other things, my neighbor, your neighbor, should also do the same. And then together we beat COVID-19.
You know, that's a great place to anchor, Mr. ABUJA. Thank you so much for sharing your thoughts this evening.
Thank you, Coyote.
Stand in front of the camera for proper face processing.
We'll take a look at this automatic disinfectant chamber built by 3 youngsters from Jos Plateau State in the north-central region of Nigeria as part of research to curtail the spread of COVID-19. But what's unique about this chamber is that it only allows persons with face masks access into public places where such chambers are installed. It took William Gang and his team 3 months to build this chamber after they had resuscitated moribund ventilators at the Jos University Teaching Hospital. The fully automated system is said to have an instant temperature test, data recording system with full body disinfectant, as well as automatic hand sanitizers.
On this, the system has a motion detecting sensor. I also have a camera where you process the image and checks whether the person is having face mask or is not having face mask before it allows the doors to open automatically. So, and the system is fully automated. So one of the main reasons of making it fully automated is to avoid any form of contact. So in the system there's no form of contact where you need your hands to open the curtain or you need your hands to open the door and the rest. So everything is being designed, and the system also have a software where you can control the system remotely from anywhere, and you can also view and record most of the information happening in front of this. So if there's any form of manipulation or to manipulate the system, there's a recording video on it where the security person in charge or the ICT person in charge will actually notify the individual.
A person with disabilities, fully body disinfectant, instantly temperature test, and it's notchless, automatic hand sanitizer, automatic cooling system, self-evacuation, wireless communication, operating without third person.
Well, interesting innovation there. Well, let's check in with graduating students writing the West African Senior School Certificate Examination, which commenced on Monday amidst the ongoing COVID-19 pandemic. Well, at public and private secondary schools in Kaduna State, staff, students and other officials observed laid-down protocols, including hand washing, temperature check, and more importantly, sitting apart to observe social distancing. At the laboratory where the science examination practical took place, the protocol on physical distancing is also observed to a certain level. One of the students, the school's principals rather, explains that they aren't taking any chances to protect the staff and students from contracting the coronavirus during and after the examination.
Before resumption, when we got the directives to reopen school, before then we were able to fumigate the entire school environment 3 times. And after that, we were able to set every facilities based on the NCDC guidelines. If you look at from the gate, at the entrance, you'll discover that every student and staff that is coming in must be with the face masks, nose mask or face shield, and without a nose mask you can't enter the school environment. And at the entrance, the student and staff shoes will be disinfected. As on entry to the reception, the temperature of the student or staff coming into the premises will be taken. The nurse is on ground to record it, and after then the person will wash his hand. We have soap solution, an automated wash hand basin where you wash your hands, and after that you sanitize your hand, and they will have a disinfecting machine that your whole body will be disinfected before entering the premises. And that is what we have at the entrance. And in the school environment, we ensure that students are monitored. There's adherence to this use of nose mask throughout the day in the school environment. When you visit our classes, you discover that we also had physical and social distancing in the classroom, observing the 2 feet or 2 meters, 6 feet in between the student in the classroom.
Well, let's head outside the country. A factory in Scotland has been linked to 43 cases of COVID-19, most of them employees of the factory, and 6 others their contacts. This has prompted Scotland's First Minister, Nicola Sturgeon, to consider further restrictions after the plant was closed for 2 weeks while staff at the site are tested. Here's more on our COVID-19 Global Update.
The World Health Organization also says the number of new cases appearing in countries such as Croatia and the Western Balkans has been a source of concern since June. The agency's senior emergency officer, Dr. Catherine Smallwood, called the region a sub-regional hotspot for COVID-19, but says a leveling off of new infections was now being seen in some countries.
The situation in the Western Balkans has been a concern of ours since early June, when we started to see cases increase, and it's been very much a sort of sub-regional hotspot over the summer period.
In other parts of Europe, Belgium, for instance, the Prime Minister, Sophie Wilms, has announced a loosening of restrictions as the number of new cases decreases in the country. She said people will no longer be required to do shopping alone and could be accompanied with another person starting from August 24th. Madrid has carried out mass coronavirus tests as part of a plan to curb the spread of COVID-19 in the Spanish capital. Many people from Vallecas neighborhood received a message from their local health center asking them to attend Federico Montseny Hospital to get tested for the virus. With less than 2 weeks left for school holidays, the country's lack of a plan to safely reopen classrooms amid soaring coronavirus infections has angered parents and teachers and drawn fierce criticism from the political opposition.
Well, just before we go, take a look at our website, channelstv.com, where you can get all the updates on the pandemic and other stories, top stories, by the way, channelstv.com. Well, that's the program for this evening. Thank you for watching. I'm Kayode Okikyolu. Do stay safe.